Hello, everyone. Welcome to our second to last sit and sip of the semester. It is crazy. So today, our bonus guest speaker, because we're doing it on a Wednesday instead of a Tuesday or Thursday, so this is very exciting, is Dr. William Seavey, and I will have him introduce himself. And then, Will, if you could also talk a little bit about just your career path, what got you interested in this particular field, with your introduction, that would be awesome.
Sure. So my name is Will Seavey. I currently am the Associate Vice President of Population Health at Northern Light Health. And the company that I work with as part of Northern Light Health is Beacon Health. I'm a pharmacist by trade. I went to pharmacy school, graduated in 2007. So then let me take you through my path. So I went to high school in Southern Maine, went to Oxford Hills High School. Decided to go to the University of Maine, and where I was a double major in biology and education. And I got in. I always wanted to work in healthcare to some degree, that was or be in education. Um, so when I was let's see what years, the year 2000. So I would have been a sophomore in college in the summer. I started working as a pharmacy technician at Eastern Maine Medical Center. So my mother had worked in the pharmaceutical industry, and she knew someone, said, "Oh, this would be a good summer job." So I started working there. Liked the worked there as a pool position or per diem for 4 years. So my wife was a nursing student, she was currently then my girlfriend, was a nursing student. So we stayed up here, graduated in 2003. And in 2003, the decision was, do I go be a teacher, or do I do something else in like a graduate school? So I decided to do graduate school and went to Massachusetts College of Pharmacy in Worcester, Massachusetts. So that was a 3-year accelerated program meant for people that already had degrees. So and I went with the support of Eastern Maine Medical Center. So um, then there was a big shortage of pharmacists. It's different today, but I came back up after I graduated in 2006, 2007, and started working as a hospital pharmacist, which is very different than a community pharmacist. They're very, very, very different jobs. So when I assume we have some nursing students, some pre-med type students on this. So where I worked at the hospital is I worked on a patient unit. So I worked in the cardiology unit of the hospital and worked within the whole care team. So what I got to do is, I wasn't staying in one pharmacy. I was working with physicians, NPs, PAs, care managers, nurses, dietitians, a little bit of physical therapy, in all aspects of medicine, really in a cardiology unit. So I did a lot of general medicine, did a lot of cardiology. And through there, got to know how the hospital worked, what all the jobs were, and really got interested in all different areas of medicine. So from that, back in 2007 to 2010, healthcare was in starting a little bit of a transition, and Medicare, which is the biggest payer in the country, does major driver of care and in the U.S. Was putting in rules that saying, hospitals, we think you can do a better job, and we think you can provide better care, and we're going to start to take away some of what we pay you if you don't do a good job with keeping patients from being readmitted into the hospital. And I found this to be pretty interesting, and worked with a team at Eastern Maine to look at readmissions in a vulnerable population. Heart failure patients it's a pretty common diagnosis in the elderly. It's the number one reason for a hospital admission in the United States today. Number one reason for readmission in the United States, and it was in a cardiology area. So when I got into that, it really started to move things to quality of healthcare. How do we keep people healthier when they go home out of the hospital? And then, kind of by accident, things tend to snowball. I think sometimes when you start asking lots of questions and are interested in a lot of areas, where I called up a colleague of mine at the administrative center of Northern Light Health, which was then EMHS, because I had been reading about these programs called accountable care organizations. And accountable care organizations are a group of providers, hospitals, healthcare systems that take accountability on the quality of their patient care, and the cost of the patient care. So it doesn't just look at, am I doing a good job today with this patient? It looks at, am I doing a good job for this patient's lifetime? And am I being good with money? Am I trying to keep people out of hospitals if they can be home? Am I doing things that are helping people be healthier and avoid really high costs? So I got into that sort of by accident and transitioned to a pharmacy type position in 2015 with this company called Beacon Health, and we're the population health arm of Northern Light Health. And as that company grew and evolved, I, was changed positions to associate vice president of population health. So today I work with all organizations that are part of Northern Light Health. There's 10 hospitals on how do we deliver high value patient care where we have high quality, the costs are taken into account and kept under control, and that patients, when they need to access healthcare, that it really works for them, that they are having a good experience or as good experience as possible when they access the healthcare system. So I work with a lot of different people all throughout the state, and really got into this by being curious and interested in how things worked. So,
That's so cool. That's such an interesting transition that you've
yeah,
gone into, because it's very, I would say it's a lot more administrative of a like side, or
it,
maybe not necessarily, but like,
no, there it is. Um, there is some administrative pieces to it, but healthcare administrators, you need clinicians in
mm-hmm,
healthcare administration,
yeah,
and when you look at the type of clinicians who are available to do some of this, some of the more administrative work,
mm-hmm,
there's physicians, which are very limited. There aren't as many, and a lot of them do direct patient care. So you do have some physician administrators, but not very many.
mm-hmm,
Nursing is a great area to get in with administration. And there's a lot of nurses. I mean, we don't have enough nurses, but there's a lot of them.
right.
But with a pharmacy background, you have a substantial amount of training. I went to school for how many years total was it? 7 years total.
Mm-hmm,
Um, so got a lot of advanced training that's a little bit different from a physician, and more like a nursing master's, like a nurse
mm-hmm.
practitioner or PA type training. So it gives you a major advantage being an administrator that has a good clinical background. So I get to do both. I get to mix in some
Awesome.
clinical work with some of the administration. So it's uh,
That's
it's
awesome.
very helpful. Yeah.
Yeah, but it also, I think it puts a really nice dynamic light on a career in pharmacy. I feel
Oh
like a
yeah.
lot of people, a lot of students, not saying everybody, but I think a lot of students still associate pharmacy with, I'm just behind a counter administrating drugs to people all
Yeah.
day.
Yeah.
And I think, and I mean, I understand why, because a lot of times that's where they're most familiar with. That's who they see as they go to the
Right. Of
pharmacy to
course.
get their drugs, and that's what a pharmacist is. But
Right.
your career path in general, and I'm sure there's many others who have very similar paths, that shows that there's so much more
Yeah.
to
So
having that kind of background and being in the pharmacy field.
Yeah, so I have a colleague that's the chief operations officer at Waldo County Hospital. She's a pharmacist,
Mm-hmm.
Denise Needham. And one of my real good friends, Tyson Thornton, is the associate vice president of operations at Sebastopol Valley Hospital.
Mm-hmm.
So, with that kind of background, you can do, really anything. The CEO of CVS Health,
Mm-hmm.
which is a giant company with health insurance and
Mm-hmm.
pharmacy. He's a pharmacist, so it doesn't. You don't have to have a certain job to become a leader or administrator. So
Right. Exactly. And that's a great point, just to be able to
yeah,
share that with students. That's awesome. Now I do know you have a PowerPoint for us. Do you want to go into those slides at least before I ask you my
sure.
COVID-19 question?
Well, let's do COVID first. Let's do
Okay,
COVID
because
because
that's a
then we'll.
hot topic.
Yeah. So
So
COVID-19 is a huge topic.
huge topic. So the
Yeah.
question I've been asking all of our guests is, how has COVID-19 had an impact on your role, on, where you are? So Beacon Health, Northern Light, just in pharmacy in general, because I know it's having an impact on every component of healthcare in very different ways. And so I'm
Yeah.
very interested in how it's having an impact on your role.
Well, I'm home.
Yes, I
Um,
can see
I'm
that.
so I am not. I do not work in a hospital today. So
Okay.
I work in a separate location from a hospital.
Okay.
So a lot of people are still working in hospitals, like the leadership teams. I'm probably going to be going back to my office very soon. But we transitioned people out of my workplace, and we're use that to spread out other people who couldn't work from home. So one of the big things about the distancing and keeping employees healthy is you want to be spread apart if you can. And this was very early in the epidemic, or the pandemic, I should say, in early March, where things were very unknown. My boss is a physician, and we were talking daily about 2 weeks before things happened, knowing this is going to happen, and we just got to start getting ready because we know it's going to come. So we were very prepared as an organization, and gave up our space so other people could spread out that couldn't work from home, because not everyone can do that. Um, so we so doing that, the people I work with at all the hospitals and all the practices, I work mostly with outpatient in the outpatient arena. Um, all hands on deck for taking care of the COVID response. So a lot of the things that I work on are innovation, performance improvement, practice improvement, doing things in a different way that are better for patients and better for staff and better for workflow, to get us higher quality. So a lot of those things all of a sudden stop. We got to go all hands on deck. What are we gonna do? And so some of that stuff stopped and canceled. Canceled a lot of meetings. We had to focus on a very specific area. So I myself got pulled into that in a very specific area. So I started helping our organizations build up those tent sites. That were originally they were for testing, just to get people tested, and then we've run out of tests, so we couldn't do the testing. But then it transitioned to, well, if people are sick and coughing, we don't want to just spread them out everywhere. We need to keep sick people into very specific locations, because for a couple of reasons. We don't want them exposing others. um, we don't have enough personal protective equipment, or PPE.
Mm-hmm.
So if you think about when you usually go to a doctor's office, you say if you have symptoms, put on a mask, and it's okay. You put on a mask and you're coughing and you go visit the doctor. Well, when we're in a potentially severe shortage of PPE, which fortunately in Maine we haven't run into any major issues like other states. We had to save those masks, and we couldn't bring those potentially infectious patients, and with all the staff having to wear masks and putting on gowns and doing things. So if
Mm-hmm.
you spread out somebody and had to do a nasal swab in a room, you had to close that room for 3 hours.
Oh, wow.
And yeah, because you generate aerosols and you have to give it the time.
Mm-hmm.
So we said, we need one place for all of these symptomatic patients to go, and we need to treat them, potentially need to treat them at these locations for um, almost emergency department level of care. So we had to stand all that up in about 10 days. Um, and there were a couple of phases, but about 10 to 14 days is when we stood up these tent sites, and then we transitioned them to treatment sites because we didn't know what was going to happen.
Mm-hmm.
You plan for the worst and hope that the worst never comes, but we honestly were hope. I mean, we didn't know. Think we were doing the right thing, but we didn't know what was going to happen back. It's almost probably 7 weeks ago now
Mm-hmm.
that things really came to a head. So, my job transitioned very quickly, and then after we kind of got those things done, we were in this waiting game for a while. I didn't have to be as involved in some of those operations. And now, the last couple of weeks, it's been, okay, how do we get back to all these other things that we used to be doing?
Right.
And at the same time, things are never going to go back to the way they were before. So right now, when we look at our data, I do a ton of work with data. I have data scientists and data analysts that work with me, to what's the understanding about how people are accessing care today.
Mm-hmm.
And some of the data we've gotten is people are getting half of their visits via telehealth now on for Northern Light Health. It's on Zoom. We
Yep.
are using Zoom for healthcare. It's a special edition of Zoom. And if it's 50-50, and that's going to be a major change,
Mm-hmm.
because it didn't used to be that way. 2 months ago, a sliver of visits was Zoom, and now
Right.
it's a huge piece of what we're doing. Um, so, now things are transitioning to, okay, how do we open back up? How do we use Zoom and this new platform of managing patients? And my role is to work with our medical group and work with our teams on how do we rebuild this in this new model and still
Mm-hmm.
get the best outcomes that we're trying to get for our patient population, for the population of Maine. So
Right.
that's probably my next 3 years of work or so, is to
Yeah,
figure
that sounds super
to work and
exciting.
figure all that out. So, and figure it
Yeah.
out for Maine and in the Maine
Right.
population.
Right.
So, and it goes.
Yeah, and
Go
like,
ahead.
and one benefit you can almost say from this pandemic, which is obviously sounds weird when I say it, but is that, one of the huge, and this is a part of the work that you do, one of the huge concerns is just healthcare access for Mainers, because there are so many up north, like way up north. People think Orono is north, and it's like, no, we're in the middle. It's so funny how many people think that Greater Bangor, Maine's north, and
Yeah.
I'm like, nope, not even close. But people up in Presque Isle, like they would have to travel 3 hours to go. I mean, they still would have to probably still do that, but telemedicine is giving them more access. So it's
Oh,
almost like
yes.
helpful that
Absolutely.
we're getting trained now to provide that health care, because to a certain extent it's now providing more access to those who wouldn't be able to get those types of one-on-one conversations with physicians and specialists that they wouldn't be able to get before.
And that's a big part of my job, will be to help put those pieces together, with others that I work with. I mean, none of this stuff is done alone or done in a
Right.
silo, but to put that together and work with our medical group and work with our providers on how to do what you just said. We were working towards how do we improve patient access. That was our number one issue that me and my boss, Dr. Gilkey, were working on, is how do we redesign care to improve patient access, knowing that we're not going to multiply doctors, we're not going to multiply nurses. We have a limited set of people
Mm-hmm.
who are going to deliver this care, so we need to deliver it in a different way. And with telemedicine, we have learned about 5 years worth of things in 3 weeks,
Yeah.
because the adoption of telehealth is very nerve-wracking for providers and for
Mhm.
patients.
Mhm.
There's a big unknown there, and people don't know what was going to happen.
Mhm.
And this made it as a necessity. We could not do certain things in person. The option wasn't there for us. So we had to quickly adapt into new ways, and that accelerated change, more than anything else. So it's
Right.
a definite benefit that's come out of this. And we're far from the end, but this is one good thing that's come out of it.
Yeah. If we can find something positive. Gotta find
No,
something
there
positive.
is. There are
Yeah.
positive things. There
Yep.
certainly are, and that's
Yep.
okay. I think to think
Yep.
that there's positive things, and
Yep.
so
That's awesome.
yeah.
Cool. Okay. So, slides.
Yeah, go to the slides.
Let's
These
okay.
aren't this isn't a presentation. Just
Yeah,
for
no, no, no.
anyone
That's
who's
totally
watching
fine.
this.
Yes, you're
So
now there's gonna be a test at the end
yeah,
of the session. No.
definitely a test.
Oh my goodness.
I was there. I went to the University of Maine, and I was a
Mm,
biology major. I remember finals week. I hope everyone survived.
yeah,
And I had what did I have? Five. Some of my business major friends. Oh, I don't have any finals, and I say, you're killing me. I have five.
I know.
Um,
Yeah.
so all you healthcare people, you get to do all the sciences, but it pays off.
Yep. Okay. So there's your intro.
Yeah.
Okay, and this
So
is the video.
yeah. So one of the questions Samantha asked me is, what are some things you'd want people to take away,
Mm-hmm.
and to go back with? And there's a couple of major messages that I felt like would be important, from my perspective. And we don't have to sit and watch this video. Well, we can. And will it record, Samantha?
It should, yeah.
Okay. And I put this as that healthcare is a service industry with empathy. So the reason I put this message to take away is that we are here um, serving people. They come and seek out care from us, um, and people have major disparities in care, because there are people that don't reach out for care because they don't feel comfortable with it, and are unsure what to do and don't understand it. So, you know, being a service industry is a different lens than a lot of people have taken, but it is certainly true today. But empathy is extraordinarily important. And the best example of empathy is this video from the Cleveland Clinic. It's about 4 minutes long. And if you want to play that, um,
Yeah.
it's definitely worth watching through and just taking it into account. This has made the rounds through healthcare circles multiple times. Is it not copying for you?
Hold on. I think here we go. I'm gonna copy this one. I'm gonna improvise for a quick second. We're gonna do this and we're gonna make this work. This is the beauty of Zoom and of just doing all this fun stuff. All right, here we go. And we will skip the ads.
Ad.
Gotta love the ads. Wow, that was an intense video. But it was very eye-opening at the same time. Like,
Yeah,
that was crazy.
yeah. Could people hear the sound?
I
I
think
couldn't.
so.
Okay, and if you couldn't, you can just type in Cleveland Clinic empathy into
Okay.
Google, and you will get that. It is a
Yeah.
very intense video.
Mm-hmm.
It is extremely true. I have seen every single image uh, in that video in my 5 years working in acute care. You will see
Mm-hmm.
all of those things,
Yeah.
and it sends home the message that you don't know necessarily what people are feeling, but you can try to understand what they're feeling
Yep.
and treat them with dignity and respect when you're caring
Mm-hmm.
for them. It's very, very easy to get busy and to forget what what you're doing. You're a lot of tasks in
Mm-hmm.
healthcare for nursing, for pharmacy, doctors. There's a lot of things you got to get done, boxes to check. But you also have these people you're taking care of, and to understand where they're coming from,
Mm-hmm.
because you're not going to like all your patients. You're going to really
Right.
not like some of your patients, and
Right.
they can be jerks, and they can be
Mm-hmm.
mean, and they can get violent. But we all have to do our best as healthcare providers and clinicians to treat them.
Right.
And
And that's why
we
you
are
got into it.
exactly, and we are here to treat them.
Yep.
And it's a great job. So, and we are a service industry, just like other industries.
Yeah, absolutely.
So number two, second message is to really understand why and be curious in what you're doing.
Mm-hmm.
Um, so there's a few situations with that stand out to me, both in my career of understanding why I'm doing something or why my boss is doing something, um, that really helped me understand the system around me, and not just focusing in and dialing in on my uh, on what I was doing on my keyboard that day.
Mm-hmm.
And being understanding why you're doing something and being curious also can save a life. Where anytime a nurse is administering a medication, they need to know what that is, why this patient is getting it.
Mm-hmm.
Every time someone draws a lab, why am I drawing this lab? Is this for a drug level? What does this word mean? In pharmacy, we worry about trough levels, the low level of a drug, so we
Mm-hmm.
know if we're giving them enough medicine. And we rely on nursing to draw that drug level,
Mm-hmm.
because you have to give it. You have to get the lab draw right before you give the drug. If you give the drug and then do the lab draw, it doesn't mean anything.
Right.
Um, and that's a medical error, because then you have to go do that drug level again, and you could have delayed care. So understanding why you're doing something and being curious about what is going on around you is is critical into being a good clinician and caring for patients. So, and always understanding why somebody is doing something, or why you're doing something. Um, why is this change happening? And if you don't know, ask.
Mm.
The worst thing is not to ask, because then you know you, you can have deadly consequences in some situations. So
Mm.
the next one, and I bring in this because it affects care today. It affects how well we can care for patients, is the resources that we use in healthcare and the costs that it costs the United States
Mm-hmm.
for healthcare results in bad outcomes for people that can't access that care due to cost. And the only way, one of the only ways we're ever going to do better with this, is being careful about how we treat patients, what medications we use, what kind of supplies we use, how much do we use. all of those things cost something, and we can't be blind to what healthcare, what things cost in healthcare. We have to be aware. And just because something's expensive doesn't mean it's bad. Some of the best treatments in the world are very expensive, and that is perfectly acceptable. But we just need to do that carefully and understanding what the costs mean,
Mm-hmm.
because people skip things because of the cost. You can read it every single day about how someone has rationed their insulin or try to spread out that medication a little bit longer,
Mm-hmm.
or take half a pill instead of a whole pill. Not gone to the ER because they were afraid they couldn't afford it. And if we could bring the costs of things down,
Mm-hmm.
and use our resources more carefully, we could treat more people better. And
Mm-hmm.
money matters in healthcare. It's not a, we can spend whatever we want. It's not like that. We spend um, more than we should, and not getting as good outcomes as we could.
Right. And I think this pandemic also has brought to light how much that money and politics, how all of these outside forces have such a role and an impact in healthcare, and how they all work together to make things possible for patients to see, like, in all that. And I think I didn't even realize it until something like this happened, where it's like, oh my goodness, like I really am now having to like worry about certain things that I never used to before.
Yep.
And so I think, showing the slide and the point that you're making is so important for not just students who want to go into healthcare, but anybody who just
Anybody,
wants to know
yeah.
what's going on in the
Yep.
world.
Nothing is free,
Nope.
and when we say, oh, I can get this treatment for free, it's, well, you actually have paid for it. It's just coming
Right.
out, it's not coming out of your wallet today.
Right.
But it is paid for one way or another. So,
Right.
just
Exactly.
being careful and aware about how we're using healthcare resources is very important. Because it's
Absolutely.
not an unlimited, it's not an unlimited bucket.
Right. We wish, but not so
Yeah,
much.
it isn't.
No.
And then the
All right.
fourth thing would be to embrace and lead change. Um, so this is just there's all sorts of ways to look at change and how people handle change. There's a whole field of study on how people handle change and
Mm-hmm.
how to go about doing change. I mean, my job is change. I mean, that's what I have to work in, and we'll use telehealth for a while. Telehealth as an example, we'd passed denial in telehealth. We were in a bit of a resistance from the government or payers wanting to pay for it, or providers saying, "Well, I can't do this over Zoom. That's crazy." Um, with some people being in the exploratory change, and then your real innovative places saying, we already got this, we're doing this, and we're doing it for real, and we've been doing it for years.
Mm-hmm.
There's a health system out in Alaska who's been doing telehealth and doing a ton of their visits via telehealth and the telephone for years, because in Alaska you can't just drive to the doctor. um, you don't have a cardiologist in every town. Well, when we look at this pandemic, all of a sudden it got into culture change in 2 weeks because
Yep.
there wasn't a choice.
Right.
And this happens. Healthcare is in a absolute explosive level of change right now,
Mm-hmm.
whether people want to realize that or not. And uh, the, the the worst thing to do is to be in the denial and resistance stage for too long. If you're in a leadership position, really explaining why
Mm-hmm.
to people of why there's change happening is important. And if you're not in a leadership position, trying to understand why this is happening.
Mm-hmm.
And what can we do, or what can I do to help the people I work with um, get through the denial and resistance. humans like to do things the way we've always done them. It is human nature,
Mhm.
but we have to change over time. It's indisputable that things are going to change in healthcare. So just to be embracing of that and to help lead that is a great trait to have in your career.
Absolutely. And I think it's important to be able for just for pre-health students to be able to demonstrate that on their application or in an interview or in a variety of different ways, because, you can also look at it as the same way of how did you handle adversity? Did
Yeah.
you come up with excuses? How did you react to it? What did you know that you can control versus what you can't control? And,
Yep.
showing that maturity level almost to a certain extent. And so I think this is just a great point that it is something that's very important to be able to demonstrate and show that you can handle it well,
Yeah.
because you're
Well,
going to be experiencing it all the time.
and it takes practice, and you're never going to do it right all the time, and
Right.
that's okay. And
Hmm.
but be open to that, and it will really help. I think it'll help you in your career, help you be happier, um,
Hmm.
as you all move forward.
Absolutely. So that was some fantastic advice to give to students. So I appreciate that. That was very deep, deep advice, and I love it. So we have just like a few minutes left in our session. So was curious if there was any other bits of advice that you would give to students who are preparing to go into healthcare. I mean, the ones you kind of already gave were pretty rock solid, but if there were
Yeah.
any other ones that you had.
Um, I mean, I think it's general life things. Have fun with it.
Mm-hmm.
It's not all serious all the time.
Mm-hmm.
You got to be a hard worker, of course.
Right.
Healthcare people tend to be very high performers, very hardworking, and
Mm-hmm.
you don't make it out of school and excel unless you do the hard work. So
Right.
just keep that going and keep the curiosity and the learning going, because you have to learn things every day because it's changing all the time. So but that's all. I think I
Awesome.
know Humane puts out some great students, so I'm one of them, and so is my wife. So
You guys,
you
yeah,
can you don't
power
have to go.
couple.
You, yeah, you don't have to go to Harvard or Stanford to do great things. So
Absolutely. All right.
I think
One
great at
last
Humane.
question.
Yeah.
What was your favorite part about going to UMaine?
Let's see. The
This is always
years
the
that
hardest
I
question.
went, the years that I went, let's see. I think a really, really good hockey weekend. And it wasn't just the game, but the whole
Hmm.
weekend. A
Yeah.
really, really good one when it was really fun. The weather was good. We had a great team. They won two national championships
Oh,
when I was
yeah. You
there.
were there when they were like, because you noticed my hockey jersey in the
Yeah,
background.
yeah. So the whole weekend, starting at about, I don't know what time on Friday,
Probably like
ending
7. Yeah. So
about,
probably like, yeah, earlier than that.
and then going through about, sometime early Sunday morning was those were fun, just relaxing, and do whatever you want and
Yeah.
all that. That was
That's
probably the best. I
awesome.
don't, I don't get to do that so much anymore.
Right. I know. Did you sit in the student section?
Oh yeah, of course. Yeah.
Okay.
I
Because
mean,
you have to experience that at least once when you're at
yeah,
UMaine.
yeah, I wasn't on the club, the banana, whatever the club was called, but I you
Oh,
know I was
yeah.
always I was always there. I,
That's
I didn't
good.
go to every game, but it was really fun. Those
That's
were fun
awesome.
times, and just with your friends, and having a good time.
Yeah. That's awesome. Well, again, thank you so much, Will,
Yeah,
for, joining us today. I thought this was some great information and advice that you shared
yeah,
with
and
our students, and
people can reach out anytime. You can share my email
awesome.
address, anytime.
Perfect.
I know a lot of people in the system, so no matter where you live in the state, I'm sure we can find something for you to do. So
Great. I will definitely share that with students. Awesome. Well, you have a great rest of your day. Stay
thank you.
healthy, and thank you
Yeah.
for the work that you're doing during this crazy time.
Oh, thank you. Thank
Yeah.
you for
All right.
everything.
Bye, Will.
Bye.